So I'm just curious, Chris. I know you're from Canada. Um,
Yeah.
and tell me about your nursing practice and what's gotten you interested in holistic nursing.
Um, I've been a nurse for over 11 years now. Um, I'm I'm also a certified perinatal nurse.
Oh,
And I'm almost done my herbalist diploma, and I do Reiki. Um, I think really like COVID kind of opened my eyes a little bit into how I've kind of lost the I want to say like the trust in like the Western medicine. I think it has its place and its purpose, but I
yeah.
think we've gotten so far away from, proactive medicine and
Yeah.
keeping your body healthy. And it's become really reactive and,
Yes.
let's put temporary band-aids on things. And that's not how I went in. That's not why I went into nursing. I went in to keep people healthy and to help people, not react to their illness. I want to keep people healthy.
Yeah. Yeah.
So
Completely
that's what's kind
understand.
of led me to more of a holistic approach to my nursing.
Yes. Yes. I believe COVID was a real eye opener for a lot of people, a lot of nurses in particular, and also a lot of doctors. I know that I had a private practice up until about last year. Yeah, about no, actually it's been about 2 years now. In 2021, I closed my successful private practice. Also because I felt the constraints of a lot of my patients, like I was trying to bring them to the certain level of health. And there were all these indications of like, yes, you need the vaccine, but my patient's autoimmune. Like
Yeah.
I don't feel confident. Like I've, there a lot of my autoimmune patients, a lot of my hypothyroid patients, they were very concerned and they didn't want to be forced into doing the vaccine. And so, and then I was prescribing certain things and it was very much resisted by a lot of,
Yeah.
not going to go into detail, but it was very much resisted by by the local pharmacy. And I
Yeah.
thought, I don't know how I can practice like this. Um, but I also, prior to becoming a naturopathic doctor, I was a nurse also. And so very much the same. Like I felt like I needed more tools, holistic tools in my tool belt. But I'm glad you're here.
Yeah, I honestly would love nothing more than to become a naturopathic doctor. Like that is what I would love to do. So in Canada, I don't know how it's set up in the States, but here, like we've got the two levels of nursing. So like we've got the registered nurse and then the registered practical nurse.
Ah, it's
I
similar.
Yeah, so I'm a registered practical nurse because when I got accepted to nursing, I got both, but
Mhm.
I learned better hands-on. And so then I was like, well, if I want to go back for RN later, I will. And I figured in nursing, working in the hospitals and stuff, I'm like, I can do everything that RNs can do. Why go for the extra schooling? And I had a toddler when I was going through nursing school. So I was like, I just wanted to start making money. And now I'm like, I don't want to go for my RN because I don't want to. Um, but I'm still considering. There's a university here in Canada in Alberta
Mhm.
that I can get. Like they will take my nursing education
Mhm.
towards a bachelor's degree in human science,
Mhm.
which then I could, and it would cut it down from 4 years to 2 years.
Oh, okay.
Um, and then I could apply from there to naturopathic medicine, but that's 4 years of full time not working. So I'm like, I don't know
Yeah.
if that's going to be attainable. So I'm I'm looking at trying to kind of build something for myself where I can still,
Yes.
I like I said, I'm a perinatal nurse, like trained perinatal nurse. So I worked in maternity, and that's where I really like my heart really is with women's health. Um,
Yes. Oh my gosh, yes.
and as someone who's gone through, I am that I have Hashimoto's, And it was when I got introduced to a naturopath that really started opening my eyes to all the things that I wasn't taught in nursing school, that I had to kind of teach myself and learn for myself. And I'm also, I went through the whole system my whole life, being told like anxiety, depression, all this, a lot of it can be linked to food. But
And also just the immune system too.
yeah. And then I also just found out at the age of 31, so it was like 2 years ago, that I'm autistic. So like, I also have quite an extensive passion for women's health and women's
Mm-hmm.
health when it comes to regards to the mist. I got thrown around so many different
Yeah.
labels when really it's just my brain just works different.
Right.
And
Yes.
I love that my brain works different. It allows me to see things others don't.
Yes.
Um, so I've become
Absolutely.
really big, like advocating for, especially women.
Yes. Yeah. And really, truly, the world is at this point where they need your unique presence, imprint, and purpose. Like, absolutely, this is such an important time for if you have a passion, now is really the time, right? And
Where I struggle is
mhm.
this side of thing is how do I launch it? Like, how do I
Okay, we're
get it going? That's why
yeah.
I'm like, okay, I need this. This is what I need.
Okay, okay. Well, so I want to welcome Andrea and I want to welcome Christina because they've just joined us. And I really hope that at the end of this, that you'll have more inspiration. You'll also see that you can do it. I mean, I think the biggest part is the marketing piece, and
Yeah.
that's a challenging for all business owners. But after you could literally set up shop after this if you have like the extra certifications and you're really clear on what you want. And really,
Yeah.
truly, like I thought, and this is really important, I thought that I needed more schooling so that I could take on clients that were my dream clients. And yes, that is true. But I got a bachelor's in biology and research. I got a bachelor's in nursing. I practiced as a nurse, and then I became a naturopathic doctor. But what I saw behind it now, looking at that trajectory, was I was hoping that more degrees would give me more confidence. And I bet you that a majority of you, what you're probably missing is like the the therapy that you really want to dive into, the demographic that you really want to work with, and the confidence. Like I
Yeah.
don't think you need to spend more years of school because now I see, and I've also like talked to other nurses and mentored them. I've trained a ton of healthcare professionals from like across the gamut. But what I typically see is it's the confidence piece. And you don't have to be like this like super expert in what you're doing and you'll get there as long as you continue every single day just being consistent. But what you need to have is the confidence that you can be the person that can take the right next step.
Yeah.
Okay. It's not that you have to figure everything out. You just need to figure out the right next step. And I hope that you'll be able to, like, after this, you'll be able to figure out your right next step. Okay. So I'm just going to get started because I have a feeling like
Sure.
I'm going to get a ton of questions. So I'm just going to get through my stuff. But just a little bit about myself. I began as a nurse, and I worked pretty much all the different floors. I worked in med surg, I worked in acute care, long-term care, I worked in home care, I was a case manager. And really what I was doing was like I was trying to figure out where I fit. Okay. And over the course of my early career, I actually got sick. Okay. And when I got sick, just like you were saying, Chris, um, I went to conventional medicine and I got the medications and I proceeded to continue to not feel better. Right. And instead of someone taking a really holistic, integrative look at what was going on, they just kept telling me, well, here, just double your dose. And then when I wasn't feeling better, just triple your dose, and then we'll tack on antidepressants and gastric. Like I was getting heartburn from the medication. So we'll tack on some omeprazole and you'll be good. And I never ever got the solution that I needed, but I actually got sicker. Okay. And then I started to discover holistic care when I met my first naturopathic doctor. Okay. And when I first met him, I was like, I'm really curious about what you're doing. Can I shadow you? And as I started to shadow him, I saw him work with people in the nursing field that you would never, like, when you see them on the floor, you would never think that they could get better. Like diabetics that had reversed their diabetes, pancreatic cancer. Like that is unheard of, to have somebody go into remission when they have pancreatic cancer, right? It's usually a death sentence. And so after shadowing him, I was like, at the very end, I was like, I want to do whatever you're doing. I have no idea what it is, but I really want to do it. And that's when I got my doctorate in naturopathic medicine. That was a 4-year post-bac program, and that was in Arizona. Now there's only about seven states that had this program. Okay. And I think they've actually consolidated it now. So there's probably 5 or 6. It's been over 10 years since I went to school. Okay. And then I started my private practice. And in my private practice, I started to see patients for trauma, mental health issues. Okay. And from that, I started to gain notoriety in the mental health field as kind of an integrative mental health doctor. My jam is really PTSD, and I'm a national speaker in different formats. I speak for PESI, I speak for the Arizona Trauma Institute, and really, truly, my passion is in mental health, but it's also in helping nurses like you who are really just sick of the system. They want to be their own boss, but they're trying to figure out how to do it. Okay. And so a lot of you are probably wondering, where the heck do I start? And you have such a wealth of knowledge, but also you have such a viable degree, right? Do I need to go back to school to do what I'm doing? Okay. And it's okay that you have no idea, because really nursing is geared towards, I'm going to get my degree and I'm going to jump right into the hospital. Okay. And really after that, it's whatever protocols the hospital wants us to do. Okay. So we're not really taught how to be entrepreneurs, or that we can actually do something different from going into the hospital, because it was never taught that way. Okay. So if you don't have any idea, that's okay. And I want to reassure you that I had absolutely no idea what I was going to do. I just knew I didn't want to be in the 12-hour shift. Right. Okay. So what I learned from becoming a nurse and then practicing, becoming a naturopathic doctor, and then opening up my private practice, I'm going to share with you so that you can translate it into your own. Okay. So the very first thing that I learned was, how in nursing school, they tell you you have to go to med surg. Like you just have to start there. Like you might want to be like a NICU nurse, but you need to start in med surg. You need to put your time in. Okay. You need to like work nights, put your time in med surg. And then after like 2 to 3 years, then you can start to go into like the floor that you really want. That's actually not true, right? When you're starting your private practice, you need to be clear on who your dream client is. Like, who is that person that you want to work with and that makes your heart sing? Like, I run a women's trauma group, and oh my gosh, like, it's a weekly thing, but it is the best part of my week. And I never feel like I'm working. I literally see these women having breakthroughs, and that just lights my soul up. Right. So my dream client are women who have experienced impactful events in their life, and I help them get back into their heart center, away from survival mode. So that's my dream client, right? So I want you to reflect on who your dream client is right now. Like, who are those people that you want to get paid, right? But working with them, you don't even need to get paid, because the payment is when you see them succeed, right? You're going to get paid for it, right? But that kind of helps you set the idea of who your dream client is. right? And then get your skills down first. So that means like the safety aspect, right? Like there are certain things that you want to make sure that you're doing absolutely correctly as a function of safety, right? Like if, for example, you need to be able to assess this client so that if they're having an emergent crisis, you need to be able to refer out, or you need to be able to say, hey, like this, like Reiki might not be the thing for your pancreatitis, right? Like that would be the safety aspect. Okay, so get those skills down first, but mostly in the realm of safety. Okay. The third thing is that it was so important for me to build my network. Okay, meaning that these are the people that are going to refer clients to me. These are the people that I'm going to have communications with on a frequent basis. These are the people that businesses or contracts that I'm going to bend over backwards for, because they are one, usually working with my dream client, right? And they're going to help me expand my reach. Okay. So think about your network, because they are going to contribute to your net worth. Okay. A lot of the programs that I create, a lot of the organizations that I work with, they're part of my network. Okay. And I continue to build relationships with them. They are my affiliates. Okay. And this is the part where I think a lot of nurses start to like lose or get discouraged. Your marketing and sales is constantly happening, right? Just the fact that I'm doing this workshop, I'm marketing myself, right? I'm marketing myself as somebody who is hopefully competent, and marketing myself so that one, it's fulfilling for me, but also you start to know me as someone who can deliver what she's saying, right? So marketing and sales is constantly happening, right? The more that you share what your passion is, you're actually selling and you're actually marketing yourself. So it doesn't have to be like the cold calls, right? You're not, or network marketing like the MLMs. It's not like that. Really, as you get more passionate, right, you have to tell people what you do, right? So you're always selling yourself. You're always selling your capacity. Okay. So my hope today is that you're going to get clarity on your initial action steps. Okay. Whether it's trying to figure out who your dream client is, or trying to figure out, okay, am I going to be an LLC or am I going to be a PLLC? Okay. A lot of the people that have been invited to this is kind of specifically for Arizona people, but it's probably going to work in different states as well. Okay. So I also hope that you'll get more clarity on who your dream client is, okay? Because your dream client is going to fuel your therapies, and it's also going to fuel your marketing, okay? And I'm also going to build in expectations on what your practice could look like, right? So I thought that if I could send out an email, right, like, oh, so many people are going to be interested in this program. That's not actually the case. It's as people, that email isn't going to get me a ton of people, right? That email is an introduction so that other people start to get to know me, right? And so really we have to manage our expectations that one action step isn't going to fuel like abundance necessarily. It's multiple consistent interactions with you that are going to get that client to come work with you. Okay. Then also finding networks that are going to help you build your practice, right? I have an affiliate that is in South Africa. Like, how cool is that, right? I never thought that I would have an affiliate that is referring me clients in South Africa, but most of my practice is online, right? I also have an affiliate that is in Singapore. Like, how cool is that, right? And that's what happened after I decided to close my physical location, right? And also get clarity on how much you want to work, right? A lot of you may have this idea of, I'm going to build my private practice and I'm going to retire myself from the hospital. That is a beautiful idea of how it could work, right? For me, that's kind of how it worked. I first worked in the hospital 2 to 3 days a week, right? And then as I built up my private practice, when I started to match how many patients I needed to meet my income, I started to decrease the number of shifts I worked. And eventually I retired myself from the hospital, right? And so try to get clarity on how you want your business to look, but also gain clarity on how you want your life to look, right? Like if you want to not work on Thanksgiving, right? Or not work for Christmas, right? It's very likely like you want to define how you want your everyday, how you want your years to look. Okay. And then also you want to define your services and your cost. Right? That's actually incredibly important. So in the beginning, it might be you're not getting a lot for your uh, initial appointment, and that's okay. When you start to build a confidence, you can start to demand what exactly you're worth. Okay. All right. Okay. So very beginning preparation. That's phase one. Okay. You want to make sure that you're getting that licensure that you need and the schooling that you need. Okay. Is it going to be an RN, an LPN, which I think, Chris, you were saying a registered practical nurse in Canada? That would be the translation for it. And do you want to get your bachelor's? Do you want to get your nurse practitioner? Right. So those would be kind of the preliminary things before you're launching your holistic practice. Okay. Then you want to look into your specialty. Okay. Do you have expertise in labor and delivery, med surg, psych, these things? You don't necessarily have to have this specialty. It's really helpful, but not always necessary. Okay. Because the truth is that conventional approaches can be radically different from holistic approaches. Okay. For example, when someone is having blood sugar issues, right? Let's say somebody's pre-diabetic, right? Conventional would be, I'm going to give them, maybe start them off on metformin, and maybe I'm going to start them off on some nutritional changes like carb cutting, and also some exercise. Okay. Functional, you could start them also on low carb, but then you could also implement a whole bunch of herbs in there, like galega, or you could also implement things like chromium. And so you could have that specialty, but functional and holistic is pretty much its own specialty. You don't need a pre-specialty before that. Okay, any questions about that? And any questions so far, you can raise your hand. You can put that in the chat. Anything to get my attention. Okay, no questions, so I'll keep moving. So phase one, make sure that you have the right licensure. Okay. Phase two is understanding your scope of practice. Okay, this is going to take a little bit of diving into what the legislation says. Okay, in Arizona, thankfully, it is quite broad. In Arizona, the scope of practice basically says a registered nurse shall perform only those nursing activities for which the RN has been prepared through basic registered nursing education. Okay, so everything that you learned in nursing school, you are allowed to do that in your scope of practice, right? Which also includes nutrition. Okay, and those additional skills which were obtained through subsequent nursing education. Okay, so there's a little bit of a leeway there saying that you can do everything that you learned in basic nursing school. Okay, and if you go on and you get subsequent nursing education, that you can also practice in your scope. Okay, all right. And then within the scope of practice of an RN as determined by the board. Okay, so this is kind of the a little bit of a loophole, right? And this is if you're going to practice something like incredibly exotic, right? Like if you're practicing Reiki, right? You've got your nursing license and then you've got your Reiki certification. Okay, that is within your scope of practice, right? But if you're practicing your if you have your nursing license and then you practice something like really wild and exotic, like, I'm trying to think of something that is so crazy. I can't think of anything right now. You then, whatever that very crazy thing is, you might want to run it through your board. Okay. It could be as simple as an email, but the other stipulations are within also your scope of practice and within the Arizona legislation is that you have to be able to stand firm and accountable in the way that you're treating your patients. Okay. So not only do you have to follow your scope of practice, but if you were ever called towards the board, you have to be able to justify your treatment of the patient. Okay. So if ever you're in doubt, right? Like, can I do Reiki on animals, right? Or can I do Reiki on, you know, um, some very wild demographic, right? Ask the board. Okay. All right. Okay. Next is your dream client, right? With your dream client, right? I almost want you to visualize who that person is, what they look like, what their problems are. Okay. Because what you are is you are an expert in solving their problem, right? My expertise is I help heart-centered survivors move away from survival mode into thriving mode because I understand that most heart-centered survivors have a hard time being in the PTSD responses. Okay. So I understand that's my expertise. Okay. And also, the clearer you are, the clearer your marketing is going to be, and the better it's going to speak to them. Okay. All right. So, another extent of the preparation is advanced practice and certifications. Okay. And this is kind of where I come on board. I'm going to do a quick little spiel. Advanced practice and certifications essentially mean that you get continuing education and you further your knowledge as a nurse beyond what is found in nursing school. Okay. And for those of you that really want kind of a holistic approach in treating clients, I am going to in October run a functional nutrition and integrative certificate. Okay. What it comprises of is being able to address things like hypertension, diabetes, chronic fatigue and more in a functional and integrative way. And we're going to talk about nutrition. We're going to talk about functional testing. Really, so for example, organic acid testing. This is a test that most nurses don't know how to read or even look or even know that they could run. But essentially, it's a way to be able to look at someone's metabolism and say, okay, hey, you have dysbiosis, you have nutrient deficiencies, you have mitochondrial issues. And I think that that might be what's going on with why your blood sugars are off. Okay. So being able to look at the functional testing, then being able to translate that into some integrative care. Okay. We're also going to be looking at the use of herbs. So if someone has hypertension, what's a really good herb to give them? If someone has chronic pain, what's another great herb to give them? Right. Or if you're like, I am not going to recommend any herbs. It's not in my scope of practice. I don't want to do it. Well, most people, at least in America, are on some kind of herbal or supplement, right? So even if you're not going to want to do it, right, your clients are very likely going to be on some kind of alternative or complementary supplement, and you're going to need to understand what it's doing to them, right? Maybe that person with diabetes, maybe like they're getting hyporeactive because they're on a supplement that is creating interactions with the medications they're on. So you're still needing to be able to help them navigate through safety issues. Okay. Um, so also in this course, we're going to be talking about stress management, things like mindfulness, things like yoga that are clinically indicated and also could be helpful for somebody with diabetes or hypertension. Okay. The thing is that it's going to be a 4-month intensive in-depth course. Okay. You're going to be working with me every single week. We're going to be pulling out case studies. I'm inviting also real live people who are dealing with, say, hypertension, so that we can really see what's going on in real time when we implement functional nutrition. Okay. Because the truth is, I get such a joy out of seeing people like doing so much better. And for someone who's just getting into holistic therapies, they kind of need that gratification as well, to know that this is actually going to help. This is actually really powerful stuff. Okay. And so that's that 4-month intensive. Hi, Rico. Welcome.
Hey, hey.
And so that's that 4-month intensive, and it starts in October. Okay. So really, it's going to be weekly. It's only 1 hour. But what I often see is that we have such dynamic discussions, a lot of questions, that it ends up being like a little bit over an hour. But here's the other thing. Not only are you going to be able to help clients, but I've seen nurses have radical changes in their own health by working through the nutrition here. Okay, so it's not just for your clients, but it's also for you. And you get continuing education credits through the American Holistic Nursing Association. So that starts in October, and it is a very small, intimate cohort. So it's less than 10 people that are going to be there. Okay. All right. So preparation phase, right? You want to make sure that you are clear on the kind of therapies that you want to offer and the type of services to help address the problems of your dream client. Okay. All right. Also, some preparation here. If you have a nurse or someone who is in advanced practice that is doing what you're doing, why not ask them to precept? Right? Because I gained a lot of knowledge when I precepted with a naturopathic doctor. I got really clear on what I wanted to do. And also, I got to see how they worked, right? Like, if you're not taking insurance, how are you getting money coming in? Right? It's a little bit rare to be able to see this, but if you know of someone, then increase your network. Okay. Um, and then you can also see how they opened up their own practice. Like, what were the things that they did? Okay. And I, I'm going to invite you to think about this word often, affiliate. Okay. Who is going to be my affiliate? Who is going to be somebody that I want to connect with, and who is going to help me expand my reach? Okay. So, as a naturopathic doctor dealing with mental health issues, with patients with mental health issues, my affiliates were therapists, counselors. They were also psychiatric nurse practitioners. They were also psychiatrists, psychologists, right? These are the people that I'm going to invite you to think about as affiliates, and really, truly, like, they're going to help. All of you are going to help improve your client's care. Okay. And also imagine, I'm going to invite you to imagine, do you want to open up your own private practice? Like, do you want to have your own brick and mortar? Do you want to sublet, like, meaning that you're just maybe borrowing somebody's massage room to be able to do Reiki, so that you're not taking in the overhead expenses, because it can get quite expensive. Okay. And that's a really good way of being able to open up shop. And then as you start to build up your clientele, then you can see if you want to open up your own practice. Okay. All right. Okay. So phase one, a lot of preparation, a lot of reflection. What is it that who's your dream client? What are your therapies going to be? What are your offers going to be like? Do you want a brick and mortar, right? Or do you want to do online? I've actually done phenomenal online. Okay. But I needed to get more skills, which is essentially being able to market myself, do copy, figure out how to do launches. And figure out how to do social media. I mean, I even built my own social media marketing team just so they would be able to do my own social media. Okay. So really, how do you want your life and your business to look? Okay. All right. Once those things are clear, okay, then you move into the action phase. Okay. If you need another license, make sure that you get that. Okay. Make sure that you have your certifications, whatever that looks like. Okay. And make sure that you're getting malpractice insurance. Okay. So this is really important to be able to get. Okay. So malpractice insurance, I think for nurses are about $110 a year. And the most reliable one is NSO.com. Okay. If you're doing some very wild holistic therapy, like for example, oh, here's a good one, psychedelics. Um, that's a really, that's kind of up and coming in the therapy community. If you're doing something that is very like new and controversial, I would call and speak to the malpractice insurance provider to make sure that they will cover you just in case. Okay. That's kind of like the CYA, like cover your ass. Okay. So malpractice insurance. And then if you are renting from a physical location, right? If you're gonna do Reiki, you're getting that sublet, you want to make sure that you are also holding liability insurance. Okay. Liability insurance essentially means that if your client walks in, trips on the carpet, and I don't know, breaks their leg, right? That liability insurance can then cover that. Okay. I know it's kind of scary. That's also why I have a online practice. Like I don't need liability insurance. Okay. So make sure that you do have liability insurance to cover your physical location. Also, if you're running a private practice that ends up having a lot of technology, like for example, nursing aesthetics, right? There's like $100,000 um, um, face lasers. And so you want to make sure that you have some kind of insurance for that as well, just in case something happens. Okay. If you are saying, okay, I don't want to practice under my nursing license, okay, which is you can actually do that, right? You can call yourself a nurse or health coach, granted that you have the experience and the certification behind that. You can do that. It just has to be explicitly stated in your informed consent. Okay, that's what I have in my informed consent. It basically says, even though I have a doctor license in the state of Arizona and I have a nursing license in the state of Arizona, when you're working with me as a health coach, we are not using that license. It just has to be clear and specifically stated. Okay. If you're functioning as a health coach and the insurance is actually quite cheap also. It's about $30 to $50 a month, depending on where you're getting that insurance from. Okay. And then just be mindful that if you're working with clients that are across state borders, right, you cannot, unless it's a reciprocity state, actually, I would probably check in on that. You want to look at the telehealth laws as well if you're functioning as a health coach or functioning as a nurse coach. Okay, I don't quite have a lot of information about that for you. Okay, so phase 2, we're still in action. Okay, now that you've gotten clear on who your dream client is, the problems that they have, the kind of therapies that are going to help address their problems, and also if you want to have a physical location, right, we're going to still continue the action steps. Okay, you're going to need a tax ID. Okay? And the reason why is because the government has to be able to charge you taxes, right? And you can get that through the website that I listed. Okay. Also, if you're planning on getting or planning on taking insurance, okay, you're going to also need an NPI. Okay. Nurses can get NPIs. Okay. So that way, at least you've got all the numbers in place before you set up shop and take your first client. Okay. Another thing you want to consider is what kind of business entity do you want to be? Okay. If you are, you probably have to look in your state, but in the state of Arizona, the type of provider you are, like an RN or a doctor, really needs to go under a PLLC. And the reason why is because it provides the most protection for you. Okay. I highly recommend that you create not a corporation, but an LLC if you're planning on moving forward with having your own business. The reason why is it does provide protection. Okay. You don't want, I know you're all going to be practicing safely, but you don't want to say, get sued, right? And they come take your house because they technically can, right? So the LLC, the PLLC, which is for healthcare professionals in Arizona, or sole proprietor, those are going to provide you more protection from liability. Okay. And in the state of Arizona, you can go to https /ecorp.az. There's the whole website there. Okay. But if you're doing a low risk type of therapy, like for example, if you're doing mindfulness, you could probably get on by without forming an LLC, right? I highly encourage it, but it's a low risk therapy. Okay. Any questions so far? I'm throwing a lot of things at you. Okay, how about this question? Is this helpful for you? Is there something that you want to know more of? Okay, all right, I'll just keep going then. Okay, you want to think about accepting insurance or not. I personally, when I did case management, I hated working with insurance. And so I promised myself after, when I had my private practice, I am not going to accept insurance. Okay. And really, truly, if you're going to accept insurance, you're really going to need another person to be able to manage the insurance claims. Okay. And the sad thing about accepting insurance is holistic therapies are typically not covered. It's typically a headache, right? It can take several months to become an approved provider. Okay. And reimbursement rates for nurses are pathetically low. Like I'm talking about the CPT code of 99211. And you can probably, depending on the going rate, it could be about $8.20 to about $25. So imagine you're doing an hour's worth of work and you're only getting paid $8. Okay. Whereas if you are doing cash pay, right? One of the beauties is you don't have to follow what insurance says. Okay. You still have to be safe and you still have to follow your scope of practice, but you don't have to go through that algorithm that insurance often tells us to do. Okay. And you can charge whatever you want that is a satisfactory cost to your dream client. You can charge whatever you want. Right. All right. Now, if you are wanting to, or you can prescribe, there's online dispensaries to think about, right? It's great because it can add to your bottom line, right? Or you can give your clients a significantly reduced quality supplement, okay? There's usually a 30% markup on the products. For my clients, they get it at less so that I can be competitive. It's a form of passive income. Okay. And it really does, you have to, again, look at your scope of practice. My favorite happens to be FullScript because it offers a lot of my favorite companies all in one place. Okay. But if you look at the supplement companies, like let's say you like working with Douglas Therapeutics, right? Oh, Douglas Laboratories. You can ask them to be able to offer you a discounted rate as a healthcare provider. Okay. All right. So back to that question, do you want to have rental space or do you want to do it online? Okay. If you're doing a rental space and you're going to work as somebody who is subletting, okay, or you're going to be an independent contractor, you'll want to make sure that you're signing some kind of contract, right? Is it kind of a split fee thing where they're going to throw clients at you, and it's going to be a 40-60 split. Usually the clinic gets a 60 and then you get 40, right? I have also seen like 20-80, right? Okay. And then sometimes you also have to look at the percent of the clients seen, because if you see more clients, then you get a higher percent split, right? So you really want to look at that contract and make sure that it aligns with you, honors you, and it's not just honoring the clinic. Okay. If you're working online, right, you typically will see a breadth of patients from different states, right? You just want to make sure that you are doing your scope of practice, you're looking at the telehealth laws, and you're ensuring that everything is still HIPAA protective. Okay. And that's where we really go into electronic medical records, right? Because you're going to want to have an electronic medical records because oftentimes it's HIPAA protective. It's cyber secure, right? It's crazy now what's happening with cybersecurity. And there are some really good electronic medical records that also have integrations of calendar scheduling. Okay. My favorite happens to be Charm Health, because Charm allows me to also schedule my clients. They can also schedule themselves on my website, and they also integrate with my online dispensary, as well as I can order functional labs through them. So it's like a one-stop shop for me. Okay. If you're not doing any of that and you're looking for just like a cheap thing, Practice Fusion, Power to Practice, these are also really good HIPAA protective EMRs. Okay. All right. Okay. So you're basically trying to get a lot of your systems in place before you start to open up shop. Okay. You're also going to need a merchant account, like a business account, right? Because you never want to collapse your personal account, personal finances with your business. First of all, your accountant or whoever's doing your bookkeeping is going to be upset at you. But also, you want to make sure that your business is having its just own separate cash flow. Okay. You can ask your bank, right? There are also merchant services that are available like Stripe. Okay. Charm also has that integration. And then there's also the little square reader. You've probably seen it like at a farmer's market or in different vendors that you go to. And that's usually a good merchant services account. Okay. And generally the fee is about 1% to 3%. You want to look at how much money they're actually taking off per transaction. Okay. All right. So more action stuff. Okay. The next thing you want to look at is client paperwork, right? Because you want to protect yourself and you want to make sure you're setting good boundaries. Okay. So the client paperwork would include things like intake forms, the informed consent. It would look at payment authorization, right? Because some of them are going to give you their credit card, and you want to make sure that you're putting in the appropriate boundaries there to cover your ass. Okay. You might be using assessment forms. Okay. You might also be using cancellation forms. So if a client cancels, what are the consequences if they cancel before the 24 hours, before the 48 hours? Okay. So that they know what to expect when they work with you. All right. Okay. We're getting to the home stretch. Phase 3 is once you've implemented phase 1, done the action steps for phase 2, you're going to move into marketing, right? Because you're not going to set up this beautiful business and then nobody's coming, right? So the marketing is telling the world what it is you do. It is also probably the hardest piece, because you have to translate to your dream client that you are the right person for them. Okay. And communication is oftentimes the hardest thing that we can do, right? Is conveying your value, conveying your worth, okay, and conveying that you know their problem like the back of your hand and you know how to solve that. Okay. So there are several phases to marketing. Okay. The first phase is really new lead generation, right? Let's just say, for example, you want to work with diabetics and you've already have your Reiki certification, right? Diabetics and Reiki certifications. Well, the best person probably to look for and to become an affiliate with is probably an endocrinologist, right? And so what you could do is, hi, my name is so and so. You can introduce yourself to an endocrinologist or an endocrinologist clinic, right? Or maybe a diabetic nutritionist, right? Hi, my name is so and so. This is what I do. I do Reiki for diabetics. Okay. And essentially, what you're going to do is create new leads, right? These are people that are interested, but maybe haven't taken necessarily the action steps to work with you. Okay. So that's new lead generation. Okay. The second step is nurturing leads. Okay. So this is somebody who is familiar with who you are, who has had some experience. Okay. Maybe they've gotten your emails. Maybe they know what kind of services that you have. Right. And so essentially what you're doing is you're continuing to convince them that you are the right person for the job and you can help solve their problems, right? You continue to nurture this group. Okay. So another way to nurture leads is also through an email list. If you have an email list and if you have any questions about building one, right? These are people that consistently get your newsletter, open it up, and are interested in what you're doing. Okay, so there's new lead generation, people that have never been exposed to you, then nurturing leads, people that have been exposed to you, and you're essentially trying to get them to a place where they're warmer and then take action to work with you. Okay. Eventually, you're also closing on warm leads. Like, for example, I had a lead today. So she was interested in basically doing my functional training, right? And so essentially what she's getting to is the payment plan, right? So that I'm in that closing phase. Okay. All right. So in this part of the marketing, you definitely need a website, especially if you're going to be working online. Okay. If you're not somebody who knows coding or HTML, right? The most idiot proof website, and I know because I have 4 websites on this, is squarespace.com. Okay, for $40, you can um, put your website on, right? And then WordPress.com, a little bit more complicated, not really my jam. Right? You're also going to need, oh my gosh, I forgot to put this, but you're also going to need a name for yourself, right? And I find that most nurses take the most time here trying to figure out the name, right? And it's important to figure out your name, right? Because everything marketing wise is going to fall under that. Your domain name, the name of your website, your logos, etc. Right? I don't recommend creating cards unless you're working with like an older generation. A lot of the things that are happening now is more through social media. Okay. And in regards to social media, my approach is really pick one. You don't have to go through all the different platforms because it's going to be a waste of your time, right? If you're not successful in one platform, what makes you think you're going to be successful in 10, right? Get one down, be masterful at that, and then start to build in all the other net platforms if you think that's really helpful, right? And then think about your referral sources. I told you therapists, MDs, anybody who is involved and invested in the success of your client, right? So in summary, I talked a lot, right? Get clarity first on how you want your life to look and who you want to serve, okay? Get clarity on the type of therapies that you want to offer. Okay. And by clarity, I really mean, what's going to make your heart sing? Okay. What do you want your life to really look like? Right. And then hit the preparation phase. Continue to get clarity on certain aspects. Then take action. And then lastly, tell the world about yourself. If this was helpful for you, please continue to join us on Holistic Nurses of Arizona. You can also join us on nursesfornaturalhealth.org. You are welcome to contact me, email me if you have any more questions. And I will also be around for the next 5 to 10 minutes. So I'm going to open up the forum. What questions do you guys have for me? Anything at all.
I have a question.
Sure.
Um, is there um like a central place that you can locate like templates for like intake forms and payment forms and kind of all that kind of stuff?
Yeah, yes, that's a really good question. So, some of the electronic medical records, they often offer a template form for those things. Okay, so you don't necessarily have to make it yourself. Um, you can just borrow someone else's. Okay? It just has to, make sure that it honors your boundaries and honors your practice. Okay, so if you look on Charm, they already have intake forms. You can also modify them so that you can make it more personalized to your business. Good question.
Thank you.
Other questions?
Oh, is this presentation going to be like available like for us to reference back to?
Yes, yes. I'm going
Okay.
to make it available on YouTube, and also I'm not sure if you're in the email list, but I'm also going to put it on via email.
Okay.
More questions, and really like this is a good time to get into the nitty-gritty of stuff.
So I do have a question. I have an RN and I'm not 100% sure, like I need more clarity. But
Okay.
also, I know I want to do something with holistic.
Yes.
I just don't know, do I need to pursue additional education? I know you talked about that in the beginning, or is that just me feeling like it'll give me more confidence? Like, do I need a certificate? Should I go back and get an NP in something?
Are you looking to prescribe?
No, not necessarily. Recommend supplements, but not necessarily prescribe.
Got it. Got it. Because the one of the biggest benefits of having an NP is really to be able to prescribe. Um, Also, the other benefit is being able to order specific functional tests. But now with the whole demographic of healthcare, you can get direct patient labs. Like your patient can go order labs for themselves and then kind of show you what the results are. Right. So you
Okay.
don't even necessarily have to. I know New York just became a direct patient care, direct to patient lab state, which I would never thought would happen.
Right.
So my thing is this, right? Get clarity first on your dream client. So is it okay if I kind of walk you through a little bit of an exercise to help you get clarity?
Absolutely.
Okay. So, and it's okay, you don't know the answer, but I just want you to get locked into how you feel, right? So just imagine your perfect workday. And you're welcome to take some time to think and really reflect on this. And then,
Okay. I think I have a good idea of what that would be.
okay. And then I'm going to ask you one more question. And in that perfect workday, and you are like ecstatic, enthused, who are you working with? And what are you doing?
I feel like that is where I get stuck
Okay.
because I've always worked with pediatrics.
Uh-huh.
And as much as I love children, I don't know if that is actually my where I see my vision, like I see it more with
Okay.
moms, with adults.
Okay. Okay. All right. So if you were to give yourself permission to really allow yourself to lean into your perfect day and your perfect dream client, that first look, that first understanding, who is that?
I really feel like that would be moms, like,
Okay. And when you think about a mom and you're
yeah,
helping them, how does that make you feel?
really joyful, just refreshed.
Okay, okay. And what is that big problem that this mom, who's your dream client, what is she struggling with?
Exhaustion and stress and all the
Okay,
precursors to diabetes and chronic illness, like bad eating habits and lack of sleep, all of that.
okay, okay. And then this, can you picture your dream client, that exhausted mom?
For sure.
Yeah. Okay. How do you want to inspire her to shift from being exhaustion? How do you want to
Right.
inspire her?
I would like to inspire her by showing her that she is empowered to cure that, if you will, to get out of that cycle of exhaustion with natural tools.
Got it. Got it. Okay. So we're discovering who your dream client is, right? And then we're discovering natural tools, right? When you think about natural tools, right? And you're bringing yourself back to that perfect work day, right? Perfect day of working with your client, right? And just off the cuff, when you're imagining that, imagine the room that they're in, imagine what you're doing, like just get a feel for this, for what it is that you're sharing with them.
I think of the things that I have been learning, just like nutrition and herbs and essential oils and exercise and sleep and all those things.
Oh, so let me make sure I'm hearing this. So you've had experience in healing yourself. Are you a
Yes.
mom?
Yes.
Okay, so you've had experience. You know the problems of your dream client because you've been there and you've healed yourself. You're the expert.
Right. Yes.
Okay. All right. Going back to, so are you becoming clearer?
Yes. Yeah.
Okay. And are you sitting in that joy of helping that dream client?
Yes.
Okay. Okay. And then as you think about your dream client, right? When you think about going back to school for becoming a nurse practitioner, how does that sit for you?
It really doesn't. And
Okay.
as I was thinking through this, it's like, I feel like it would make me seem more valid if I had some more letters behind my name when I'm out to market myself, like
Hey,
instead of just Christina, the nurse you've
got
always known,
it. Got it. So what I'm hearing, right, is, and let me just make sure that I'm amplifying your truth, right? I'm not subtracting or changing your truth, but it sounds to me like going for a nurse practitioner degree would just give you more validity externally.
Sure. Yeah.
Okay. Okay. Yeah. So oftentimes, again, what is more valid is your experience and your ability to have recovered from their problem, from the problem that they currently have.
Yeah.
Right. And what I've often seen, right, when I work with people that have had trauma, most don't care that that I'm an ND and I'm an RN. What most people hear is, you're a PTSD survivor. What was it that you did? How'd you get over? How did you heal yourself? They're more interested in how I got from where their struggle is right now, to where I'm at presently. Does that make sense?
It really does. Yes, for sure.
Yeah, yeah. And so what I'm hearing is that nutrition, herbs, and supplements. But I also suspect that there was a little bit of like, did you coach and counsel as well?
For sure. That's part of talking through all those recommendations and whatever. So for sure.
Yeah, yeah. So what I would focus on is probably, right, building up your capacity as I am Christina. I'm a mom that brought myself out of burnout and into joy, into recovery, into healing. That's a lot more convincing of a story than I'm Christina. I work in pediatrics and I'm a nurse practitioner also. Right? Which one resonates with you more?
For sure, the first one. Yeah.
Yeah, because you're speaking to their problem and you're speaking to the emotional part of them, which, and granted, like you could go get your nurse practitioner, but I have a sense you're at the end of the nurse practitioner program, you're still going to sit with the same problem.
Right. Yeah.
Like, am I good enough?
Yeah.
Yeah. Yeah. Um, I think you would be a good candidate for the functional and integrative nutrition program.
Hmm.
I think that it would help you gain the confidence that you need because you've never actually created the algorithm for how to get your client from their problem to healing,
Right.
right? That's where you need the confidence is how can I think through this, right?
Yeah.
And how can I create that integrative care plan for them that includes meditation, exercise, nutrition, and how can I get that to them,
That makes
right?
sense. Yeah, for sure.
Yeah, that's because when your dream client comes, you don't want to prescribe. Do you want to prescribe them medication? Up to you,
No, no.
right? You want to, what do you want to give them?
Things that they probably have easy access to and more like they can empower themselves, and feel good like I do, that I have done this.
Yes, yes. Yeah, and honestly, like the experience that you need to help your dream client, you already have.
Right. Yeah.
Yeah. Yeah. Yeah, so functional integrative starts October. If you guys are
Okay.
interested, email me. Um, the link is also in the are you on Holistic Nurses of Arizona? The Facebook
Yes.
group?
Yeah.
Awesome. Okay. Yeah, yeah, yeah. It's gonna be a great course. Great course.
Awesome. Thank you
Yeah.
so much.
Yeah. Okay. Any other questions? Okay. Well, please follow me. I'm on Instagram as Trauma Healing Doc, also Nurses for Natural Health. That's my organization. I'm pumped to help nurses like you out. So shoot me any question you have. Okay. Everyone have a good night. Bye.
Bye. Thank you.